Philadelphia Ujima is a health initiative funded by the Office on Women's Health. And we chose the name Ujima. Ujima is a Kwanzaa principle that means collective work and responsibility.
And Ujima, in terms of collective work and responsibility, is how we focused on how we can get this done. Nobody can do it by themselves, we have to do it together. And so our goal was to find individuals and sites that realized that perhaps if their first mission wasn't health, that certainly their second mission should be health in terms of having a healthy population. And as a result of that, we were able to develop collaborative members within our network so that we could really sort of take that message home and have it resonate where people work and play and worship and live.
As part of our program, we've worked together with our community partners to really try to improve health. And some of the topics that we've focused on have been heart health, nutrition, physical activity, cancer prevention, all of what we like to call the frequent flyer health issues that impact so many people in this community and our nation at large.
Our goal is to result in having what we refer to as an activated patient. That is somebody who is ready for their doctor's appointment, does know their numbers, is able to sort of engage, and more importantly, serves as role models for other members of their family. We've been delighted at our successes in terms of getting people to indeed know their numbers, get to the doctor, understand about screening. We've had an amazing number of lay health ambassadors, those individuals who are point people at their different agencies, work with us and be able to spread the word and take the message home in relevant ways.
Clearly, as we look at what's going on in healthcare in the United States, Ujima is a big part of where we need to go. Patients need to learn how to take better care of themselves. We know what patients need to do for their cholesterol, their hypertension, their colon cancer screening, their breast cancer screening. These are issues that we understand can save tens of thousands of lives.
I found it very rewarding and enlightening to how much I didn't know about healthcare, especially for women and families, and it helped me change my life as far as getting in shape, losing weight, eating healthy, and I spread the word.
We are getting ready to do a noon workout with the staff at Drexel University.
We also got programs here at lunchtime for the staff to do something healthy for themselves during their lunch hour, and they've been really great in encouraging people to participate.
The sites that we work with just love all the things that we do. One in particularly is a food label card game that we implement with all of our site partners, and it's a game that really just teaches people how to read the food label, how to make healthier food choices.
We've partnered at various sites with Ujima Philadelphia to provide HIV education and actually testing. Initially, we had a set time limit for most events, half an hour presentation. What happened is we actually would start a presentation, we'd actually have it only for 20 minutes, but it would end up being 45 minutes because of all the questions and answers. So it was a very good partnership. People weren't just there, to get a free meal or to, spend time that they wouldn't otherwise know what to do with. They really wanted the information, they really needed the information. And not only did they actually engage in the conversation and actually get tested, and also the other programs that were also being presented at the time, but they would tell their friends about it, they would tell their family members about it. They would actually go back into the community and say, hey, you folks need to be here at the table getting this information.
We had, through one of our programs, a person that through doing screenings through blood pressure, her blood pressure was so high that the doctors actually called the ambulance for her and made her go to the hospital then and there, which probably ended up saving her life.
I think I wanted to be a part of Ujima because I wanted to gain knowledge and skills, not only for the community, but for my family as well. I wanted to make healthy lifestyle choices, and I think Ujima helped me make the right choices and decisions by all of the knowledge that they provided and the materials they provided as well. We were able to change home first, and from us changing home first, we were able to go out into the community and also spread the knowledge that we learned.
I enjoy the program because it helps others to help themselves. You get to talk about diabetes, you get to talk about hypertension, you get to talk about cholesterol. These events actually save lives.
In my talks with them, I found that they were able to teach me about the things that they struggle with socially, financially, that prevent them from maintaining their health. It made me understand better what things that the things that they struggle with.
I think Ujima is different from different other, programs or any other training because not only are they feeding us information, but they're giving us all the tools that we need to go out and present also in the communities. One of the biggest things I like about Ujima is it feels like a family thing. It's not, okay, here, we're going to give you this, go out, whatever. They're passionate and compassionate about what they do. So that kind of draws people in.
I've been fortunate to be involved since the very beginning, and it's been a very rewarding experience for me. One of the overall things I think that I've received from it, or how it's impacted my life, is how this project has really benefited other people. It's just been such a vast reach in terms of how many people this project has been able to reach, the resources, how many people's lives have been changed. Just being around the different workshops and seminars has been beneficial to me, and just even hearing people's testimonies or how people have talked about what they've learned, how they've impacted their lives, and how they've taken that information to impact other people's lives. And I think that's really powerful, seeing how many people, how many lives were touched, not just the people present, but the people connected to those people. And I don't think I've seen a project like that anywhere around.
I just hope that Philadelphia Ujima continues to do the work that it does, provide the resources that it does, and to provide the screenings that impact individuals and that change lives.
I think that in terms of my hopes for the program in the future is just simply to continue offering what we offer, to continue to be comprehensive and holistic in our approach to health education, health promotion.
What's very clear is that in the Department of Medicine, and certainly within the College of Medicine, Dr. Anna Nunez has been a great leader here in the college in developing these concepts. And she and her team continue to need to be supported, and I look forward to encouraging that as part of our overall effort to develop women's health education initiatives here at Drexel, since this is a great part of our legacy as our medical school.